I've always been fascinated by minimal invasive surgery.
This is definitely the future of surgery. It allows us to do more complicated type surgeries in a minimally invasive fashion.
The view that you can see in robotic surgery allow you to do surgery more precise.
The camera system on the robot is better than any surgical camera system on the market.
The advantage of doing robotic colon surgery is that you have the capability to see better. The anatomy and the pelvis can be very challenging. To be able to see this up close allow you to do the surgery more accurate without making mistakes.
I think a real advantage is better cancer operations. In terms of lymph node dissections, you can see more lymph nodes, you can go after those lymph nodes. The magnification is tremendous.
I think that's another advantage. And the other one that is the cosmetic part. Every time you make a small incision versus a large incision, the risk of infection decreases.
When we use regular traditional laparoscopic or thoracoscopic instruments, it's almost like holding chopsticks and you're moving instruments like this. Whereas the robotic arms act more like a human hand, and you have wrist action, so you can move in any direction. And once you become adept at doing robotic surgery, you'll see decreased complications. Specifically with chest surgery, you're going to see decreased arrhythmias, decreased lymphatic leaks, decrease in the amount of wound infections.
Patients get a faster recovery. Manipulation of the tissue in surgery is less, so the bowel function returns faster. As a result, they can start eating, resume activity faster, and go home faster.
And then the other thing that is less talked about, but also vitally important, are less complications.
Also, the amount of pain. I notice that when we do robotic surgery, the patients are up and about right after surgery. They require less pain medication.
So all of these things will translate into better long-term outcomes and hopefully better long-term oncologic outcomes.
I don't consider myself a superhero. The fact that I have these extra skills now by using the robot, it gives me the satisfaction to know that I can even help my patients even more than what I was doing before.
No, I wouldn't think of myself as a superhero. I'm still a physician, a human, a surgeon that I've spent quite an amount of time dedicating myself to helping others. That's what I love to do.